Applying to residency can be tough. There's a lot of moving pieces, and especially if you're doing it for the first time. Doc, tell us a little bit about what was the hardest part for you in this application process.
Yes, definitely. There's definitely a lot of hard parts when it comes to applying to residency programs. But I would definitely say the two hardest parts were waiting for interviews to come through because not everything came through at one time. And it was kind of honestly spread out between like 2 months of waiting from when I got my first interview to when I got my last interview invitation. But kind of that waiting game after you submit your application and then you're waiting for interviews. So you're just spiraling in your head, thinking about everything. And then I think Student Doctor Network is a really great tool to use when people start hearing back from programs. But I think it's hard too, because some programs that you may have applied to, other students may have received interview invites and posted about it and you didn't. And so I think that is always hard, to comparing yourself in that aspect. So I definitely think that in the fall, that kind of waiting interview process was a little bit difficult. And then definitely after my last interview, waiting until match day, we were in it for the long haul. And, it's a highly anticipated day when you're waiting for match day, but definitely well worth it and exciting. But, you start spiraling and thinking back to all your interviews and I should have said this, or I could have said that better. So I think definitely the waiting for both interviews and then for match day were the hardest parts.
Yeah, the waiting. Pediatric dentistry has become one of the top specialty programs in the world. Not only is it tops, but it's also very challenging to get into. Stay tuned as we talk to a D4 student who matched into Pedo this cycle. She's going to tell you how she did it. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, another episode of Ask Dr. Darwin on the New Dentist Podcast Show. We talk about getting into residency, getting into dental school. Got to get into dental school before you get into residency. Get into residency and then life as a new dentist. Guys, be sure that you stay tuned, stay locked in to this channel, all right? Share, comment, and also join, but also support the channel. This content is being brought to you for free. We design it as a resource to help you in your endeavors in getting into dental school, getting into residency, and then your life as a new dentist. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com right here. GetIntoDentalResidency.com, the ultimate resource to help you get prepared for your residency application and your residency interviews. For more details, check it out down below. Looking forward to helping you get into residency this cycle. All right, guys, special guest today, individual who's been working hard on this get into residency cycle this past year, and the fruits of all of her labor has paid off. She has matched in Pedo. Today, we're joined with student doctor, soon to be officially Dr. Thomas, Alexandria Thomas. How you doing?
I'm good, Dr. Darwin. How are you?
I'm great. Not as good as you. Future board certified pediatric dentist. It's official now. It's completely official. And we're so happy that you are here to kind of share your journey to Pedo. Before we get started, just please introduce yourself for people who are meeting you for the first time. Tell us where you're from, which school you're at, and a little bit about your background too.
Absolutely. So my name is Alexandria Thomas, like Dr. Darwin already said. I'm a current fourth-year dental student at UMKC School of Dentistry in Kansas City, Missouri. I'm originally from the Kansas City area and attended Baylor University in Waco, Texas for my undergrad career, and then came back home to Kansas City for dental school. And then I'll soon get to share with you where I'm going next for residency.
So why Pedo? Why did you decide to do and explore and make pedo your preferred specialty, your preferred pathway through dentistry?
So I chose to pursue a career in pediatric dentistry because I love, the fast-paced, upbeat, energetic environment. I'm in it for the kids. I think the most neat thing about pediatric dentistry is that as a pediatric dentist, you have the opportunity to see your patients every 6 months, and you get to see your patients grow up and walk through different milestones, and cross different hurdles in life and things like that. So um, that's kind of what drew me into pedo initially, and kind of sparked my interest in it. But I definitely think, after treating my own patients, like in the dental school and working with them and being able to like discuss, procedures to more nervous kiddos and, make them excited to come to the dentist and make them feel comfortable and safe whenever they're in the dental chair. Those opportunities that I had in dental school to kind of start working with kids is really what showed me that this is my passion and my calling. And there was nothing else for me other than pediatric dentistry.
Also, keep in mind, well, people don't know this, but they're getting ready to find out that you've got some people in the family that are specialists, one of which is a pediatric dentist too. So that may have had some influence, or at least some influence along the way, I'm sure, as well. So that's so you're lucky to have, be able to have that type of introduction to pedo as
No,
well.
definitely.
Yeah, and I know your mom is excited.
She is so excited. So my mom is actually a board certified pediatric dentist, and I spent so much time growing up in her dental office, shadowing,
Mhm.
transitioning through different roles in her office. But definitely, those opportunities and experiences that I had to seeing my mom work through her career in pediatric dentistry and how much she loved it and how successful that she's been just in the pediatric dental realm really definitely sparked my interest in the field as well.
Absolutely, absolutely. Well, to get into the field of pedo, you got to apply, and that means you got to get an application together, and most specifically the ADIA Pass application. So share with us a little bit about that process, because quite honestly, for specialties like pedo, that process really starts much sooner than people can even imagine. And we'll talk a little bit about why. So tell us a little bit about how you prepared your application.
Yes. So it was a very long process. I started in the spring of my D3 year, and I started asking teachers and faculty members for letters of recommendation. It's really important to start early with the letters of recommendation, just because, faculty are busy. They have lives outside of school as well. And so it's really important that you ask for those letters early on. So then after you submit your application, you're not just sitting around waiting for the letters to come in. So I definitely think that's the most important thing, is to ask for the letters early on, and then start making a CV and thinking about personal statement as soon as you possibly can. I tweaked my CV and personal statement so many times, and it's definitely a process, to get your CV together. You're at this point in your D3 year of dental school or wherever you are, and you forget about everything else you've done along the way. So if you could, write everything in an Excel sheet and kind of keep track of it to, know what to put in your CV, that always helps as well. That's kind of what I did. After I would volunteer somewhere, I would write it down in an Excel spreadsheet. So then when I came time to start making my CV, I had, everything organized that I had done. So that process started pretty early. And then the ADIA Pass application opened up in May. And so at that point, I started, looking at things online, and what people had done in the past. And that's when I found Dr. Darwin, and I started watching some of his videos.
Hey.
And so I started watching some of his videos about students, who had successfully matched in Pedo, the process they had taken to get there. And so that's when I reached out to him, and then he was able to help me so much in the application process. But I started working on my application the day it opened up, just filling in all of that information about yourself, your address, your school information, all of that. Yeah. And then after I started inputting information into it, like all of the service that you've done, the shadowing, leadership and everything, that's when you really have to, make sure you have all your information together, because it's the same application basically that you submitted for dental school, and you have to have all the information there of for every service activity you did, who the supervisor was, their name, their title, their phone number, email. So getting all of that information in there as well in the application definitely was a little challenging, but you get through it. And that was the great part about talking to Dr. Darwin then about my application was, further refining my personal statement and figuring out what I needed to include in my personal statement, what was important and what wasn't, and kind of length for a personal statement, because with a DIA pass, there's no length that your personal statement has to be, or you're not limited to so many characters. So, making sure that you have a personal statement that's concise, but not redundant, and not anything that's like super duper long, because obviously the admissions people at the programs don't want to read a five-page personal statement. So
yeah. And you got to keep in mind, the admissions committee is looking at hundreds of applications that have personal statements. So concise and the most salient points are wanted and needed, so that the review can go seamlessly without, feeling like the admissions team is looking at an application or looking at a personal statement. It's like, oh, here we go. Same thing. Here we go again. It's the same one. Oh boy. So you got to keep that in mind. And you're right. We started early. We started working together in July, right? I think it was July. June. So that's important to keep in mind. Also, keep in mind that you really started much earlier than even June. You even started earlier than your senior, D4 year, D3 year. At some point early, in your first and second year, you kind of had an idea, I'm sure, that Pedo was the way, right? Pedo was the way. And you did a couple other things that I know about related to getting a Pedo internship / I think it was Pedo honors. It's called Pedo honors at your school.
Yeah.
Being selected, applying for that Pedo honors, where you have one-on-one experience and connection with the Pedo department at your school, and with the current Pedo residents, the current program directors. All of that is content that's part of the preparation for your application too. So just want to let people know and remind them that it starts probably much sooner than D3 year. And it's not just about it's not just about the application, writing the application, putting the CV, personal statement together, but it's also, what are those things that you're participating in? Student government, student organizations, special honors courses, or experiences like Pedo or ortho or surgery. What are those things that you're going to be looking to add into your application when it comes time to open up a DIA pass and start dropping things in? So that's all part of your application preparation as well. So I just wanted to note that because that was something that we highlighted. I remember we highlighted in your both your personal statement and your CV, the fact that you were selected out of a application pool of, I don't know, it was like 30 or 40 people that applied for Pedo, and you were one of 5 or 6 people that got selected. So that was something key to highlight moving forward.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com. newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode.
But then once you finish your application, well, even before you finish your application, part of the application is selecting the schools, right, or the programs. And there are a lot of different programs. There are school-based programs, hospital-based programs, even programs that are based out of a federally qualified health centers, right? FQHCs. So share with us a little bit about how you decided to come up with your list of schools and why you applied to those certain programs.
So I chose to apply to 17 different programs across the United States. One big thing for me was I had read a lot about different kinds of programs online, but everything, sounded so similar. So I wanted to apply to a wide variety of programs because if I was given the opportunity to go and interview there, then I would, be able to get a glimpse and see what their program was more about, whether that be hospital-based, the combined programs, university-based, hospital-affiliated, or like Dr. Darwin was just saying, like the federally qualified health center programs. So I applied to a wide variety of programs. I thought I was interested in one type of program, but then, when you're there and you get to see what a combined program is like, or like the university-based programs or hospital-based programs, they're all so different. And so I think I would definitely recommend applying to a wide variety of programs, just because if you get the opportunity to go and interview, you get to kind of see what it's all like and get a glimpse into what it is to be a resident at that program. So I wanted to apply a wide variety of programs. Another thing that I looked at, and that's really important to me, was family. So I moved out of state for undergrad and was not close to any family and came back home for dental school. And my family has been such a big support to me in dental school. And so when I was looking at programs, I looked at different locations, where I had family in close proximity to me. If I ever, needed something, I knew that I had people around me. So that was something that I looked at for some of the programs. And then, also just being able to have my mom as a resource as well and talk to her about different programs, like programs that were world known or world renowned for certain different aspects in that case as well. So I mainly stuck to programs here in the Midwest since I'm from Kansas City, but I also applied to a couple programs down in Florida because I have a bunch of family down there as well. And then obviously in Texas, because that's where my second home is. So yeah, I applied to a wide variety of programs between all 17 of them.
Yeah, so it sounds like one of the themes for you was family, and which happened to coincide with some nice weather
Oh,
Especially the
definitely.
programs that you interviewed in Florida. I know we talked about the Florida programs. Like, yes, this would be so nice. The
Oh,
weather,
absolutely.
So, but that's good. So we have a better idea. So 17 programs that you apply to, and then like we talked about previously, which is the hardest part, which is the wait. Got your application in, you applied to the schools, and then you have to wait. And in your case, it was a couple of months because we started the process, very early, right when PASS opened up. So it was what, a good 2 months?
It
Was
was.
it 2
So
months, 3 months?
I
3 months?
submitted my application on July 5th, and then I got my first two interview invites on September 15th. So
Yeah,
it was
there you
it was
go.
quite a waiting game.
It was a waiting game, and that's just part of the process. So interviews, let's talk about that. Let's talk about the number of interviews that you got. And I'm going to get my popcorn and water ready because there was a lot of interviews. And also share, just kind of give us a brief overview of what interview days were like. I know there were a couple of that were both virtual and in person. And any questions or any particular questions that kind of stood out, that were maybe tricky, or ones that you didn't prepare for, or maybe didn't think about. So interview days.
So I applied to 17 programs. Like I said, I was very blessed to hear back from 11 programs with interview invites. And unfortunately, two of them were on conflicting days. So I accepted 9 interview invitations. And those 9 interviews were to Children's Mercy Hospital here in Kansas City, Denver Health, St. Louis University, Iowa, NYU Langone, Tampa, University of Florida, Naples, Cincinnati Children's, Texas A&M, and UNMC in Nebraska. So that was
That's
the
it.
9. That was the
Wow.
9 I interviewed at. But I also heard back from San Antonio and Case Western and had to turn those ones down, unfortunately, due to conflicting interview dates.
Yeah, that's tough. That's tough.
And that's
That's
always
tough.
hard, because you don't want to turn down opportunities because you're like, what if that was the program, I was meant to be at? But, everything works out for a reason. And you just have to keep telling yourself that through the cycle and stay positive and
Yep.
optimistic about all of it. Because, as long as you're hearing back from programs and getting interviews, that's a good sign that there's something that they like on your application. And that means you get the opportunity to get your foot in the door and go there and interview.
Yeah.
So like Dr. Darwin said, I had a couple of virtual interviews. So I had 2 virtual interviews and 7 in person, which made for lots of fun places to go and visit.
Yeah, you had to travel. I hope you got your frequent flyer miles together because you did a lot of traveling.
Yeah, definitely. My last 2 interviews were in the same week. And so I went to school Monday, and then I left Tuesday afternoon and had a social for that one in Dallas, interview on Thursday, interview on Wednesday. On Thursday, I traveled down to Naples, Florida, had a social there that evening, and then interviewed in Naples on Friday. So I had a couple of those back-to-back interviews that were kind of crazy, but it made for some fun places to stop by and good people to see along the way too. So
what were some of the hardest questions that you had in your interview?
So my very first interview, the hardest question I got was, what is an animal that you are most alike, or you could use to describe yourself as professionally?
What is an animal that you can use to describe yourself professionally?
Yes.
Okay. Yeah, that's different.
So
That's definitely different.
that was a very challenging question. And after that interview, me and Dr. Darwin actually had the opportunity to meet and talk about that question. And he had some great input to say for that, that I still remember. But some examples that he said, if you do ever get this question, would be you could say you're like a beaver because they're really meticulous when they're working on and building their dams. Or you could say you're like a bulldog because you're an advocate for your patients and, you want to stand up and fight for what you believe in. So there's a couple different examples. If any of you get that question, know how to properly answer it.
They can be tricky. Some of those questions can be tricky, and some of them are even questions that they want to see how you think. How
Definitely.
You think on the spot, like, and you'll get some case-based, clinical case-based questions from time to time as well. All of them is a reason why you need to get prepared. You need to practice. You need to know a list of some typically asked questions and how, some ways that you can answer them based on your personality, based on your experiences, based on the content that's already in your personal statement and your application. So that's important to know as well. Well, you had some great interviews, 11 invitations, and you took 9, and you traveled between the West Coast, Midwest, not Midwest, Mid America, and then also East Coast down in Florida. And then not too long ago, about a month ago, you had to do the next step, which is rank your programs. Put your programs in the list from number 1 to, in your case, number 9, which makes it even harder because you have so many things to consider, because you have so many programs that were interested in you. So share with us like how you went through that process and why certain programs for you were ranked higher than others. And then once we do that, we'll do a quick reveal of where you're going to be going to.
Yes, definitely. So I worked with Dr. Darwin through this whole process. And I think the most important thing that he had taught me after my interviews, he described it as the brain dump. So after your interviews, you come back and you write everything down that you can about the program, what you like, what you didn't like, how they made you feel, the names of people that interviewed you, so you can send thank you cards or thank you emails to them. But I think that's the most important thing because my first interview was October 15th. My last interview was December 2nd. And then I submitted my ranks on like January 13th. So there was so much time in between there, between January to October when I had my very first interview. And as much as you think you're going to like remember it and it's all going to come back to you from that day, you're not going to remember a lot of things. So it is really nice, to write all those things down, so you have all those things to consider when you're making your rank list. Because it is difficult when you're looking at 9 programs and you're like, how am I going to distinguish between, you always have your bottom 2, but how are you going to distinguish between the rest of them? So I had 6 different factors that I went off of when I was making my rank list. And those 6 factors that I looked at was OR access and exposure to trauma cases. I really wanted to come out of a residency program, really efficient with my skills. A lot of residents had told me that being in the OR is kind of when you're able to gain speed and become faster. And so I wanted to be able, to get a lot of OR cases under my belt in residency to increase my speed and do all those full mouth rehabilitation cases as well. I wanted to get exposure to trauma because in pediatric dentistry, you're dealing with kids and kids fall and accidents happen and, crazy things and teeth come out. And so I want to be prepared with anything that would walk through my door later on after I finish up with a residency program. Something else that was important to me was looking at programs that treated special needs patients and medically complex. And I wanted, again, to be, well-versed and feel confident in treating any type of patient that walks through my door later on. And then something else that's really important is I want to become board certified. And I want to be able to be successful in taking the qualifying exam. And I want a program that's going to prepare me for that. So that was something else that I looked at. What kind of boards prep does the program offer? How do they prepare their students for the oral exam? Are there oral board examiners in the faculty of the program that would be able, to conduct mock boards, or what do they do for their residents to kind of help them be successful? Obviously, something else was location. Like Dr. Darwin said, I had some pretty fun places that I interviewed at. So that's definitely something you always have to consider. And then another thing for me is I really wanted to learn more ortho. I think that interceptive orthodontics and pediatric dentistry really go hand in hand. And I wanted, to also learn a little bit more of that. And then something else is, the feeling or the feedback when you're at the program. Like some programs, they obviously can't tell you, that they're going to rank you or things like that. But, you want the program to make you feel good and make you feel welcomed. And, you want to get along with all the residents that are there, because that could be a place you could be spending your next 2 years. So that was also something I looked at, was like the feeling and feedback. And so I was able to kind of go through those 6 things that were important to me, and then go through my 9 programs and then kind of figure out, okay, this is what is more important to me for these programs. And then at some point I was like, okay, location is also really important, because it could be really fun to live in Florida and get out of the cold weather in Kansas City. It could be fun to go back to Texas, where I went to undergrad. So all those different factors, come into play as well, especially when you start thinking about your rank list and thinking about, okay, am I going for the program? Am I going for the stipend? Am I going for the location? What am I really, going there for? So those are all good things, to think about, but also to ground yourself and know that you're going for a residency program. So that's the most important thing, is what you're going to get out of the program.
Absolutely. And the best program for you is the one that selects you, that you match with, because that's the program that's going to train you and get you on your way. So Cincinnati Children's Mercy, Kansas City, Texas A&M, Baylor, University of Florida at Naples, Denver Health, Nebraska Medical Center, NYU, Tampa, and St. Louis, and Iowa. 9 programs that you had to rank. So it's time for the reveal. So share with us where you're going to be taking your pediatric dentistry talents and aspirations to. Where did you match?
So I will be taking my pediatric dentistry aspiration and talents to the University of Nebraska Medical Center in Omaha, Nebraska, which is actually where my mom attended residency for pediatric dentistry.
Wow, small world. Congratulations. That's great. Awesome.
Thank you. Yeah, I'm so excited, and my mom is so excited. Omaha is just a short 3-hour drive from Kansas City, so it's very close by. I have a bunch of family up there, and they just have a great program. It's called a university-based program, but it's actually based in the Children's Hospital in Omaha. So it's almost more of like a hospital-based university affiliated. But UNMC kind of has all of it. So you get the opportunity to go and teach dental students in the Pedo clinic your second year. It's hospital-based, so I get that OR exposure. I get that exposure to trauma cases. I get the special needs and medically complex patients, because it's the only children's hospital in Nebraska. And right now, their second-year residents are in Nashville for the boards prep course. So that will be fun to be able to travel for that in a couple of years as well. So that program made me feel super welcome, and I acknowledged that my mom had gone there too. So that was really neat.
That's awesome. Well, I know this process has not been easy. It's definitely is rewarding, especially since you just matched, right? But also share with us, knowing what you know now and going through this process, share with us some tips and advice that you want to give to those D4s, there's upcoming D4s or other individuals that are planning on applying to Pedo. Give us like 3 or 4 top tips and pieces of advice.
So my very first tip is I wouldn't be sitting here today with the position I have at UNMC if it wasn't for Dr. Darwin. So I would definitely recommend, he's such an amazing resource. But, like we said, reach out to him early, get set up with him through the application process. He's so great to be able to walk through the application process and the interview process. The rank list, everything start to finish, I just thought went so seamlessly. And it's so exciting, to be able to share the exciting news, especially with him on match day, because he was there with me from day one. So I
was sitting there like waiting for you to text me like, okay, where we at? Good luck. We're keeping our fingers crossed. You ready? I remember.
That was the best decision I made with this whole process. So I would highly recommend that. Another thing is for any of those first or second year dental students that are watching who think that they want to specialize, might not be pedo, but if you have a want in something else, just start, exploring that early on in dental school, because your first 2 years fly by. And then before you know it, you're sitting in the clinic as a third year student, and then you're getting ready to apply to residency. So start looking into different things early on, but also if you think you want to be, or you want to specialize, get really involved as well, because grades are important.
Say that again.
Get involved.
Get involved. Yes, definitely.
Your grades are important, and so is your class ranks. You have to keep up with that. But for me, I was involved in a bunch of different leadership opportunities. I was president of the American Student Dental Association at my school. But I would say definitely get involved early on, because when they look at potential future residents, they want somebody who is a team leader, can work well with others, someone that has a positive, attitude, who's there to get their work done in a timely manner, and make it out of the program. So they're really looking for somebody that's going to be able to get along with others, and that's a team leader. And I think that those leadership opportunities or experiences that you're a part of kind of show that you can work with a team, but that you're also a leader yourself. Something else I think is just to be yourself at the interview. I was so nervous for my first interview. I felt like I really didn't get to show them my true personality. But you need to have those 2 fun facts to be able to share about yourself and that make you stand out. And mine was that I'm a bird mom, because I have a bird that came from Florida. And that was something that Dr. Darwin, helped me to emphasize in my application. I'm a bird mom, and all the admissions or faculty, they just sat there and looked at me and they're like, what does that mean? And I don't think anybody else came through and said they're a bird mom. So that's definitely something, that makes me stand out. So, thinking about those little things, that make you stand out, especially when you're at the interview. And definitely, talking to other students at the interview too. I made so many friends along the journey now, and I'm so excited that they all matched, and I'm excited to see them at conferences. But I think that's something else that the programs look at, is looking at you interacting with the other applicants, because that could be your future co-residents, and they want somebody that's going to be able to get along, with the people that are there, and they want the new residents to be able to get along as well. So I would definitely start early, get involved, use Dr. Darwin, and just have fun with it.
We are here, and thanks for the shout out. I do appreciate it, and it was great working with you. Like I said, we started early. We started right when the pass application was opened up, and which gave us enough time to really cultivate an application that was representative of you, but also being able to highlight those things that are part of who you are and who you want to be, and how you want to show that to the admissions committee. So it was great. What's the best way to get in contact with you? People have questions.
Yes, definitely. I'm more than happy to answer any questions, whether it be about, even if you're specializing in a different specialty. But if you have any questions from the application process to interviews or anything, you can email me. And my email is atz72@umsystem.edu.
Guys, check that out right up here. Right up there. Sounds good. Student Dr. Thomas getting ready to be an official doctor in a couple of months, and then on to pediatric dentistry. You did it. Congratulations. And this has been how you've gone through your journey in becoming a Pedo resident, and now you're going from student and applicant now to Pedo resident through this process. Thanks so much for sharing. And guys, go to the next video right now. Go to the next video. Don't wait. Just go to the next video. That's our time. Love, peace, and smiles. And go to the next video.